Well, hello and welcome to all of our viewers around the world. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Well, welcome to everyone joining us here today. We are getting ready for all of our neonatal conference at goldneonatal.com. I know many of you join us every year at this amazing conference. And again, this year, I have to say we have incredible topics and presenters who are all very passionate about sharing their experience in the neonatal unit. And of course, we've got people coming live from around the world, which is also my very special guest today. Here we have Ylva Thernström Blomqvist, who is here with us. And she is going to be talking about her up and coming presentation at this event. Now, I do want to remind everybody, this event is coming up very soon, so get ready. It's going to be a fabulous experience of connecting those people around the world. I honestly can't wait. We begin on May 31st with Terry Moran, and she's going to be here with us. So, and everybody can come to our live opening keynote, which is one of the wonderful things about our conferences and events. All you need to do is go to the website right now. You can check out all the timelines for each of your time zones, of course, around the world. So goldneonatal.com, where you can register for this event, our opening keynote, and get ready for some fantastic learning. Well, welcome to my guest today, Ylva. It is so good to have you here today. You are an absolute joy to work with. I appreciate so much that you're going to be speaking on a very important topic to me, as you probably know, because I can't stop smiling when we are together talking about this topic. And I know that many people find this topic very important. So I'm just going to tell people the topic, and then we'll get into where you are in the world, that type of thing. They're going to know now that because this is in the topic title, of course, the Swedish experience of parental involvement and nurturing care of extremely preterm infants in the NICU. And I know that you have some amazing content to share, because I got to see some beautiful videos that are really going to stand out for a lot of people. But let's start by having you please introduce yourself to us and tell us where you are in the world and what you're doing today and in your career.
Thank you very much, Fiona. I'm so happy to be here. And I'm also so very nervous about this, because I know that all of you listening also are working at the NICUs all over the world. So this is making me, of course, nervous. So my name is Ylva Thernström Blomqvist, and I'm living in Uppsala. It's an old university town in the middle of Sweden, in the northern of Europe. And I am one of two head nurses working at the NICU. And I am a registered nurse and have also do some research about kangaroo mother care, skin-to-skin care of preterm or sick infants, and parental presence, for example. Almost every day, I am here at the NICU in Uppsala. And this is both my job and also my passion in life. I really like this.
I know you do. And I know that you have been working today, and it was a hard day today. It was a hard day.
It was
today.
A tough day. Yes.
Yeah. And I say this because many people who are listening, many people that work in the NICU, they go through this, experience. It can be very hard at times, but also very rewarding at times as well, where there are successes and there is a community amongst everyone who works there, and that you enrich each other's lives as you work together and work hard, to have successful outcomes in this moment. So many of us listening appreciate kangaroo care, have some knowledge about it. Some of us have researched it and worked in it. But how valuable is it today in our NICU. We've done it for a long time. It's still relevant though, and we're still working hard to make it happen. Does it happen spontaneously for you now in the NICU? Is it something that is just happening all the time as normal?
No, I think that it's quite normal, but we have to work really, really hard for this all time. You know, it comes new stuff, it comes parents from different kind of cultures in the world. That could be sometimes a problem. We also, but I think it's really, I really think that this is the normal thing in our NICU. So we want the parents to be here 24/7, and we always strive to don't have the infants in the incubators.
Mm-hmm.
We want to care for them skin to skin, and we try to do this as the normal thing. But I don't think that you can just relax and all the stuff, just drink coffee or something, because you need to work for this really hard all time.
Yeah, it's so interesting because I have been talking about kangaroo care my entire career. So sometimes it feels like it should just be, everybody should know, but I feel you are correct. I mean, it's correct. We have to continually educate.
Yeah.
And I love that you said about families. Of course, families come from different parts of the world, and different cultures, different backgrounds. Everybody has folks in their community that perhaps have never heard of this. Or if they have, they still do not understand why it's important, the why. You know, we do it, but why is it important? And of course, kangaroo care saves lives. It changes so many things. Do the families get excited when you share this with them, and your staff too? I mean, I can just imagine you're talking all about it. And
yes, but of course it changed lives. It's important for the parents, it's important for the grandmother who can care for her preterm infant skin to skin, it's important for the siblings and all things. But it's also a really tough job for the parents, because we want them to care for the infant skin to skin at least 6 to 12 hours per day, and some do it 24 hours per day. So of course this is a tough job, and sometimes they are not so happy during the time, but they are happy afterwards.
Right, they see
but all
the
the
results.
time, yeah, they know that this is important and this is something that I can do for the best of my infant. But some days they think it's not so easy, and it isn't. But it isn't easy to be a parent to a infant in need of care for NICU either.
No.
So I am, or we are sure that it's not better for the parents to be at home. It could be better for them to be with their infant.
Yeah, I can hear this. Go ahead, please, Ylva. I'm finished. Yeah.
I just want to say that it's so important. It's important for the infant. It's important for the parents, but it could also be a tough job. And our role as the NICU staff, both nurses and physicians and all professions, we need to support the parents so they can handle and do this in the best way that it could be. So it's a tough job, and parents are not always happy about it, but afterwards they are always happy.
Yeah.
But right now, they could be tired or something like that.
Yeah.
But we want them to be with the infant anyway.
Yeah. It's very interesting you say this, because I'm thinking now from the perspective, I'm so excited as a professional. I want to share this with you. I want you to get excited about it. I can tell you that the outcome is going to be good and positive. But in the moment, they are dealing with grief. They are dealing with the loss of what they thought it was going to be. They're dealing with other children. Jobs, so many things. It's a barrier. It could be a barrier to getting them to do this. And so it could be a cost, at the expense of the entire relationship. So this is very interesting to me too, on how to care
Motivate
for
the
them.
parents.
Yeah, to
And
care for them
motivate.
in that time. Finally, I want to ask you about your staff again, because I think there is an assumption sometimes, that everything is, everybody believes the same way, that you all work in the NICU. And so therefore, this is just going to happen. Many places around the world, this is just going to happen. That's what I was going to say. But many places around the world still struggle to have the parents on the ward. There's no accommodation for them. There's not enough space. There's not enough nursing staff to teach this. So I want to know how you got here. How did you get here to the point that you have your parents even accommodated and the staff all believe the same way?
Yes, I sometimes wondering about that too. But I think in Sweden we are a tax-paying people, and we have really good parental benefits. So both parents can be at the NICU during the whole NICU stay, and they are getting paid for it. So they don't need to work. So they have parental leave, and they still have a year, over 1 year of parental leave when they are discharged from the NICU. So of course this is really, really good. And are the parents not here, they are not pay for it either. So we pay them to be here with their infants. Yeah. And also since about 1 or 2 years, the convention of the FN's barnkonvention, it's called in Swedish, United Nations. Can you help me with the word? United Nations Convention of the Rights of the Child. Is that
yes, I understand what you're speaking to. Yes.
Oh, it's a Swedish law since 2 years ago. So if you are born after 22 weeks, or if you are a 5-year-old boy, you have the same rights, and you have the right to have the parents there all the time.
Wow.
So of course this have influenced us too. But I think that the thing that influences us is that we see that the parents, even though that it could be tough sometimes, they feel much better afterwards because they doesn't leave their infants. And also we see amazing progress in the infants because they are so much more stable when they are cared for skin to skin, even that they are really, really sick or really, really small. We see that it's good for the infants.
Yes. Yeah.
And that good. It's really important for us.
Yeah. No, I hear you. I think that, so thank you for answering that question. And I recognize that Sweden, has put these things in place in order to protect children. And we as outsiders, I live in Canada, and, many people around the world see this. We look towards Sweden as a model, of care. And I think that we should all be encouraged that maybe we don't have the policy or the practice the same, where we live. However, we have a model to look to. We have successes that we can say, we can present, and we can thrive, towards this. So I think it's important that we take all of this into consideration, as we sort of start to look at our own practice in our NICUs, wherever we are in the world. So this is going to be so valuable to so many people. Thank you. Thank you very much. Thank you for sitting down with me. I know you're going to be here live at our Gold Neonatal Conference, speaking again to this topic. And this is going to be wonderful to hear, the accomplishments, to hear the process, and to understand better, what we can do to change wherever we are in the world. And again, this will be the Swedish experience of parental involvement and nurturing care of the extremely preterm infants in the NICU. Thank you so much, Ylva. It's so good having you here today.
Thank you very much.
And thank you to all of you, our viewers, for being with us. We'll look forward to having you back once again at Gold Neonatal Conference. You can check it out at goldneonatal.com for all the times and scheduling for all the other topics as well. We'll look forward to seeing you all online. Have a wonderful rest of your day, everyone. Bye-bye for now.